Hello everyone, so I'm Angie and I'm at the Eco Midwife on Instagram. And tonight we are going to be talking with Sam from Kube Medical in Swindon, who's a chiropractor, all about pelvic girdle pain in pregnancy, which is very, very common. Around about 1 in 5 women will have pelvic girdle pain within pregnancy. And this is why it's so important to discuss and talk about pelvic girdle pain so that people can help themselves and get treated within pregnancy. So I'm just going to invite Sam to join. Hello, Sam. How are you?
Very well, thank you. How are you?
Yes, not too bad. How's the little one?
Yeah, it's good. Just about starting to sleep for longer than 2 hours, which is nice.
Oh, bless you. And how old now?
Uh, 5.5 months, will be 6 months on the 4th of April. So
Wow, that's gone so quickly. I've
I
just
know.
had a little message from a
Yeah,
mum I taught a year ago, and I was like, you can't have a 1-year-old. That doesn't work.
yeah. Well, Grace is 7 this year,
Oh,
which is
crikey.
it's quite astounding, really, because it's her that started me on this journey of going further into peds and pregnancy. So that's pretty scary. I feel quite old now.
It's amazing what children can do actually in terms of guiding you in sort of life in general, isn't it?
Well, yeah, it was a bit of a kick down the road, really, rather than a guide, because she had a bit of a difficult birth and a few other issues afterwards. And obviously, I was aware of, what colleagues were doing with little ones. So I was, I had this newborn baby, and I was like, oh my God, help me, do whatever it is you're going to do, because she wasn't feeding particularly well, and she had a few other issues. So yeah, taking her to one of my colleagues in Southampton, and then realizing just what an amazing world that all was. I then sort of started learning from him because he runs seminars all over the world. And I mean, it's only sort of an hour and 15 minutes away. And it's just, I've carried on down that road, really.
Fair enough. So, just for everyone who doesn't know you, so what are you? Where are you from, Sam? What's your background?
So my background, I'm a chiropractor, trained in at the Welsh Institute of Chiropractic. I've been graduated or qualified now 14 years. Originally from Norfolk, but ended up in Swindon courtesy of the Royal Air Force because I joined the Air Force for a couple of years as a medic reservist. It's based out of Lynham. So at the time it was the height of Afghanistan war and there was a lot of 24-hour standby duty, so I didn't want to go far from Lynham. So applied in the local area, got a job in Swindon, and I just have never left. I'm still here. I promised my mum it would be a short-term thing, and I'd move back to Norfolk eventually, but that's not going to happen now. She's
No.
she's just about accepted that, but it's still a bit of a bone of contention. So.
And in terms of chiropractor, what is a chiropractor?
So chiropractors typically we deal with any joint issues really. Anything that's got a joint in it is our bag. Mainly spinal stuff. People sort of naturally come to us with low back pain, neck pain, headache, sciatica, that sort of thing. But really anything that's, as I say, that's got a joint in it that's muscular. And within the profession, as is the case, and I guess probably in midwifery as well, there's people take their special interests and they go off into different areas. So sort of at Cube, we've got one of our chiropractors who's big into his running. We've got another one that's big into his golf. So they're sort of more sports performance based chiros, deal with a lot of muscular imbalance and function and that sort of thing. We've got a McTimoney chiropractor who deals more with visceral techniques, so organ release, fascial release. It's a really gentle technique is McTimoney. Works beautifully for people with polymyalgia rheumatica and chronic fatigue syndrome and those sort of ailments. But as I say, typically it's joint, it's muscular pain, but within the profession there's huge amounts of variety of what different people find really interesting. So
Brilliant. And tonight we're going to kind of focus on pelvic girdle pain because I think that's something that comes up so much in midwifery, in women's health, and everything else. And as I was explaining just before you came on, is actually 1 in 5 women will have pelvic girdle pain within pregnancy, and it's so common. And I've got my little pelvis here to sort of like just run through. pelvic girdle pain, great minds think alike, can affect any part of the pelvis, isn't that right, Sam?
Absolutely, yeah.
Because it used to be called symphysis pubis dysfunction, which is this part here, because
Yeah.
of all the stretching of all the ligaments within pregnancy that help to soften all your joints to be able to accommodate the baby's head through the pelvis. But when it all softens, because of the manipulation of the bones and everything else, actually what that causes is that discomfort within your hips and pelvis. Where it used to be known as symphysis pubis dysfunction is where most people thought that all the hip pain and everything else sort of originated, but it's not like that anymore, is it? It's actually the whole pelvis can hurt at any stage.
Yeah, it can do. I mean, I've seen a real shift in the past few years away from the terminology of symphysis pubic dystrophy to pelvic girdle pain. And it seems to be a bit more of a catch-all. It's a bit like sciatica, to be honest. It's a catch-all for anything that's generic to whether or not it's got leg pain. I mean, the amount of patients we get coming in and going, oh, the doctor said I've got sciatica. They haven't even got leg pain. It's just back pain. But with pregnancy, as I say, there's been this shift, and it is just any generic pain in that kind of area, and it gets labelled as pelvic girdle pain. There is still symphysis pubis dystrophy, as you rightly said. This little bit at the front is the pubic symphysis, and it can separate. It literally can separate in pregnancy, and it's excruciatingly painful. But it doesn't necessarily mean there's any issues or pain at the back or in the hips. I mean, the other thing, we get no end of patients coming in with saying, I've got hip pain, and then they start pointing to the back here. That's not your hip. Your hip is here. It's at the side. So, you know, if you've got pain at the back, it's these two big joints at the bottom, either side of the sacrum. But as I say, symphysis pubis dystrophy is absolutely still a thing. It's not gone away. It's just kind of been relabeled, and it's much less specific in the labeling. But it's, as I say, that one ailment itself is just excruciating.
And what symptoms do women normally have when they have sort of this like overall type pelvic girdle pain then?
It ranges. I mean, it can just be just a generic ache, and that tends to be latter stages of pregnancy. And a lot of the time, to be honest, that's just because baby's getting big, baby's getting low, mum's starting to struggle. Your gait changes. You move from sort of swinging the legs through to more of a waddle because you've got baby's head in your pelvis. It can be a really sharp shooting pain at the front, to even like a dragging pain in your vulva and down into your groin pain. I get a lot of patients come in, and they say they put up with the vulva pain, and it's either been labelled as thrush or varicose veins. And I often say to patients, have you actually had anyone either check you for thrush? Have they done a swab and checked it is thrush? Or have you had a midwife had a look and checked that you have got a varicose vein? And invariably the answer is no. And often it's not. It's not either of those two. It is symphysis pubis dystrophy, but it's coming from a particular ligament called the round ligament that actually attaches into the top of the vulva, and actually if you release that ligament, you can get rid of the pain in, you know, deep into the vulva and into the top of the groin. The other thing we see quite a lot of, certainly late stage pregnancy, is something called meralgia peristhetica, which is where there's a tiny little nerve that comes under the inguinal ligament that comes from you can feel this bit at the front of your pelvis and onto the pubic symphysis, and it slips underneath there, and it supplies an area of skin at the front of the thigh, and it can make it feel numb, completely numb. And that again, late stage pregnancy, that's something that happens quite a lot as baby descends and the bump sort of drops forward, and it literally just compresses that nerve. But it can be treated, and you can release it because it kind of gets stuck under the ligament. So if you just release all the stickiness around there, it's not very technical, but that's kind of how it works. Just release it all off and free the nerve up, and hey presto, suddenly you've got feeling back in the top of your thigh, which is great.
Absolutely. And I mean, are there people who are more susceptible to pelvic girdle pain than others? Is there sort of maybe jobs or past history, medical history?
Yeah, absolutely. So there's a huge increase in the chances of getting pelvic girdle pain. If you've had it in your first pregnancy and then you have a subsequent pregnancy, typically it starts sooner, and it's often more severe. If you've had any low back issue or injury before you even had a baby, that's a precursor for pelvic girdle pain. But it's also something we're seeing more and more of as a profession because people sit for so much much longer, and I don't think recent circumstances have helped that at all. But because us mums, we try and juggle work and babies and children and everything else, and the tendency is to work as long into the pregnancy as you can, and often that means either you're in an office environment already, so you're sitting for long periods of the day, or work changes what you're asked to do, and that tends to be more sedentary work, so you sit back to sitting more. That causes a lot of the muscles, certainly the low back muscles, to tighten, and that in itself is a precursor again for pelvic girdle pain.
Can you prevent it in any way? Is there any way to prevent pelvic girdle pain, especially for those who have had babies before, maybe? I know certainly pelvic girdle pain is excruciating having had it. Is there a way that you prevent it if you become pregnant again in the future?
You can minimise the risks of it happening. I wouldn't say you can prevent it. And I speak from personal experience here. I had pelvic girdle pain a little bit with my daughter. It wasn't too bad. And when we were trying for my second, obviously we were trying, so we knew it was going to come. So I did all sorts of gym exercises and got treatment and everything else from the guy that's trained me. And it was still absolutely horrendous. I ended up going down to see him pretty much weekly from as soon as they released lockdown right the way through to when I had him in October. I couldn't walk more than about 150, 200 meters. It was excruciating. So, and I did everything that I could. So it gets to the point through a pregnancy when your pelvis becomes that dysfunctional that it is just a case of, actually, we're going to have to just manage this through to once you've had baby. But the good news is, us as women have an amazing 12-week opportunity after we've had baby to reset that pelvis, because everything's still loose and floppy and we've still got all that lovely relaxing floating around. So you can literally kind of encourage that pelvis to come back square, and that, I think, is one of the reasons that people or mums get pelvic girdle pain second time round much worse if they've had it before, if they've not had treatment. Because you have baby, and even if you've had the most amazing birth and there's no issues, whatever, we spend so much of our time sat down feeding that you end up sat in squiff positions, and you've still got all that relaxing, and the pelvic kind of is encouraged to go back in a squiff position. So then you get pregnant again and the pelvis is in the squiff position, and then it just, the problem perpetuates itself. So my words of advice to any mum that's had it first time around and is having a second pregnancy is get treatment as soon as you can after you've had first baby, because, as I say, it's only 12 weeks that you've got to try and reset that pelvis, but it is an opportunity that you've got there.
And it's also being aware that actually pelvic girdle pain, you know, the pains and the aches and everything else can continue for some women for some time after birth as well. You know, for some women, actually, the birth of their baby fixes most things for them. But for a lot of women, it will take a few weeks at the very least before they'll start feeling any more comfort or better. As much as you've taken the weight of the baby off, like you said, actually, the pelvis is still a bit squiff. It's still really relaxed. That it's like a myth almost, isn't it, that you have a baby and it's all completely fixed and you have no more pelvic pain ever. Doesn't quite work like that, does it?
No, it doesn't. And you've still got all the muscular dysfunction that will have set in through the 9 months of being pregnant, and before that, if you've had an issue before that, you kind of starting on the back foot a bit, really, and that can cause problems years after you've had a baby. The amount of women I see with, you know, sudden onset of low back pain, they've done something daft like bent over to pick a piece of paper up and bang, the back's gone and they can't straighten up, and you chase the history back and it turns out they have had pelvic girdle pain. And you know, it's never quite black and white, but you often sort of think, well, I wonder how much of this is still actually because of the pelvic girdle pain during the pregnancy and it's never been resolved properly.
And in terms of, I mean, chiropractors are private, aren't they? Are there any chiropractors on the NHS anywhere in the UK for those who are sort of around the country at all?
There are some over, I believe there's some in Newcastle, some in Cornwall and some in Essex, but it all depends on the funding from the local GPs, basically, as to whether or not there is chiropractic available on the NHS. But typically, no, it's not available. It's just physiotherapy.
And for most women, that is the case as well. And I certainly know that in most areas, you look at a 6 to 8 week waiting list for physios on the NHS in most areas, if you're lucky at all. And a lot of the physios, some are doing some hands-on through lockdown, but most are doing virtual and just guiding through exercises and things. And I have to say, even prior to COVID, I had a referral to physios as a midwife in my pregnancy with pelvic girdle pain. And the exercises did nothing. And that is something that keeps coming up on some of the questions, actually, is why don't the exercises work? And why will only hands-on treatment work?
Because you cannot rehabilitate a muscle if the joint that it's attached to is dysfunctional. It doesn't work. And that's the same whether you're dealing with a pregnant lady or any Joe Blogs. It's a bit like having a car and repeatedly changing the tyre without getting the tracking system sorted. You're just going to end up with the same bald spot. You've got to get the tracking system sorted. It's really important.
It's a really good analogy. I quite like that. That is something my husband would use. I really like that. So, and it's something I've always encouraged as a midwife, having seen how it worked wonders for me. And I have to say, bending over pools as a midwife, you know, it just didn't help pelvic girdle pain in the slightest. And being on your feet for 12 hours a shift, you know, it just didn't help. And I know so many midwives who go through pelvic girdle pain because we're in manual handling based jobs. And actually seeing my osteopath every week just to have that manipulation. Oh my God, the manipulation was just like a miracle, quite frankly. It just makes such a difference. You suddenly feel like you can walk freely again. You can actually move and be mobile, which is wonderful, isn't it?
Yeah.
So the other questions that have come along. So can it relieve itself in pregnancy? Can it suddenly become better in pregnancy without treatment?
I have had patients where that has happened. I've treated them once or twice and then for whatever reason not seen them again, and then caught up with them after they had the baby, and they said, you know, it magically got better. I don't know that I'd like to think it didn't magically get better. I'd like to think that the 1 or 2 treatments that I did do actually helped it get better. But it really depends what's causing it, and that's why having a consultation with someone like myself, or, you know, whoever you see, whether it's chiro, osteo, physio, whatever your preference is, I'd say the most important thing is just make sure they have got some postgraduate pregnancy training, because it's not something that's covered as a standard part of the degree course. And there are certain techniques that you can use and certain techniques you really, really shouldn't use, especially with late stage pregnancy, because there's all sorts of other issues that you need to take into account for. So it's super important they have had post graduation training. But yeah, you have to really consult one of those professionals, find out what the cause is. That's our first job, is what is causing this, and then treat that. So yeah, it just depends what the cause is. And I guess sometimes if it's just a dysfunctional thing and it's something we can give patients some advice on, you know, about seating posture and trying to get them out of the workspace where they're just sat at a computer all day, then yeah, I guess it can resolve itself. But it's not something I see. But I tend to only see the really severe cases, because most people either just grin and bear it, or they'll wait for the physio department, by which point, as you say, it's 6 to 8 weeks further down the line, and then they're kind of at the end of their tether because they've had the physio, unfortunately it's not worked, and they're now usually about 6 weeks away from having the baby, and they're just like, please just make it go away. So I just see the severe ones.
And I have to say, I mean, the severe end of the scale is being on crutches, really. You know, that is the really significant end of pelvic girdle pain that I see. And certainly as a midwife, I very rarely see it resolve itself. If anything, I see them at sort of 20-ish weeks with some generalised hip pelvic pain, discomforts. And the closer to their due date they get, you can just see it becoming more crippling as the pregnancy progresses, because actually you've got that increased weight of the baby on this pelvic floor, on those bones, on the muscles. And also you've got to think about the posture changes that happen as well, because actually you're starting to arch your back out a lot more. You're trying to actually manoeuvre everything. And then, of course, that has all the impact on your pelvis and your ligaments and how that sits as well. And so that all has a real big knock-on impact. So from a midwifery perspective, I rarely see it get better. It might stay the same, it might stay static for some women, but I rarely see it suddenly just get better with no treatment and no input from anybody.
if you've got a mum that's getting pelvic girdle pain at 20 weeks, especially if it's first time mum, you know that's going to be a tricky one to deal with. Usually first time mums starts nearer 30 weeks. They're usually not too bad. Second time mums, if they've had it first time, yes, that's normally 20 weeks. But as I say, if you've got first time mum that's getting pelvic girdle pain at 20 weeks, that's one that definitely needs hands-on treatment and fast.
Absolutely. And what other things can people do to actually help manage the symptoms of pelvic girdle pain at home and things?
Um, there's lots of stuff you can do. One of the exercises I give my mums all the time is sitting on a birthing ball, as soon as they can, really. Get them out of the sofa. We've all our favourite side of the sofa, right? So we all sit there and we lean on one side and we swing our hips up to the other side. So effectively you're sitting on one side of that pelvis, and you're now sitting literally just on this bit here. And I mean, as I say, pregnant or not, it's terrible for your posture. So get off the sofa, get onto a birthing ball as soon as you can. And teach mums to write the alphabet with a pelvis. So you write it in capital letters and then you write it in lowercase letters. It's just a bit of a mind thing. It just gives you something else to focus on, sitting there wiggling. But it just gets that pelvis moving and releases any sort of tension that might have built up in there during the day, releases the ligaments, because the uterus is attached to the sacrum and the sides of the pelvis by some really, really strong ligaments. So if you've got a pelvis that's a little bit torqued, that's going to reflect through the ligaments and then into the uterus, and then as the baby grows bigger and bigger, that's one of the reasons that it just gets worse and worse and worse. So the ball is lovely. Swimming is great, and I think you can get your weight, get the weight off. I mean, I know you can't do that at the moment, but hopefully that restriction will lift soon.
Yeah, I keep saying yes, swimming pools will be open.
I know, it was a lifesaver for me. Taping is really good. A lot of my mums get benefit from taping, and the only caution with that is that because your skin tends to get a bit more sensitive as you get further into a pregnancy, sometimes, whereas taping would normally not irritate your skin, it suddenly irritates your skin. So just be mindful of that. But to be honest, just YouTube that. There's loads of videos out there about how to apply tape. You can buy the tape off Amazon. It's not difficult. You might have to get your other half to help you tape it up, but you can just pop some tape under the bump and up and over the bump is really helpful too.
I mean, what about pregnancy belts? Because I get asked about them all the time. Is actually, all these belts that are on the market, do they help? Do they make any difference? And that's something a physio would sometimes do as well, isn't it?
Yeah, is belting. They can. It's very, very individual. I hated it. It didn't work for me at all. It made it much, much worse. And I think if you've got true SPD at the front here and this is all inflamed, the worst thing you want to do is put a belt on and compress it. It just makes it worse. It's even more uncomfortable. But if it's just an SI based issue, so something at the back, popping a pregnancy belt on, SIJ's belt they're called, sacroiliac joint, can help. Some mums think they're great. There's two that I recommend. There's the Sorola, which is literally just a band that goes round, and then there's the BB Hug Me, which is much broader, and it's got a bump piece of material that comes up and over the bump, so it gives you a lot more sort of general support, so it doesn't give too much pressure over that pubic symphysis. That was the one I just about tolerated. But generally I'd say to mums, if you can, try and avoid them. If you're going out for a walk, or you're just using it during the day at work because you've got to be on your feet all the day, then yes, use the support belt, but try not to rely on it too much because it can make it worse.
Perfect. And that's a really good answer to have as well, because I can never answer it as a midwife. We're just not given the level of information about pelvic girdle pain that, chiropractors, physios, osteopaths are ever given. And it's always a bit like, well, you can try it and see what happens. Go and find someone else who probably knows a lot more than what we do, really. And one of the other questions that came through on the question boxes today is actually, will it affect labour? Is there anything from a chiropractic experience that you can see if it's untreated, for example? Is there any link between SPD with other things?
So as far as I'm aware, there's no solid research to say yes, there is a link. It's actually something I'm considering doing a PhD in, but it's on the radar. But from a clinic point of view, I would argue yes, there is a link. Because if you've got a dysfunctional pelvis where the sacrum isn't square as it should be and it's rotated, it then flares the big joints at the back here. So if this sacrum is rotated, it's going to flare the ilium, which completely alters the aperture. So it goes from being a circle to an ovoid. And we know that that then closes the aperture off by about 1.5 centimetres. So they tend to be the longer labours, and then mum gets tired, baby gets tired, and then mum ends up on her back. And that's, as you know, I mean, the safe delivery of a live baby is always the most important thing, but you know, from a mechanics and a midwife perspective, if we can avoid having mum on back when she's giving birth, it's much easier for baby, it's much easier for mum. So I would argue, yes, there is a link, but as I say, unfortunately, at the moment I don't know that there's any solid hard evidence to go, yes, there is a link.
And I say from a midwifery perspective, so some of the things that is offered sometimes for the significant end of sort of pelvic girdle pain is an early induction, which of course then increases the risks of other things that happen. And it doesn't mean to say that the woman necessarily accepts that induction, but sometimes it's one of those things that actually, if we bring your due date, you know, a week earlier to offer an earlier birth, some women will take it because actually you reach a point with pelvic girdle pain where it's unbearable, where you just want this baby born. And then of course with any induction there comes the increased chance of a cesarean birth, it comes with the increased chance of an epidural, and the moment you're sat on your back, as you've said, actually this no longer moves. You know, the moment you're sat on your bottom in labour, this no longer opens up, this restricts the outlet massively, so the baby doesn't rotate properly and then is less likely to be born vaginally. From a spontaneous birth element, from experience, I haven't noticed anything from the women going into spontaneous labour who've had SPD. I haven't noticed any major sort of links between anything. What I tend to find is that women with SPD sometimes getting in and out of a water birth can be slightly more challenging, and that's just because of the swinging open of the hips of getting over the pool. But once they're in it, actually they feel a lot more comfortable and relaxed. It's just that movement in and out. I have to say, in general, OP babies are a big thing, and I think almost it seems like every woman coming through at the moment has a back-to-back baby and has a really slow, long, prolonged labour, whether or not they have SPD or not. It just seems like at the moment back-to-back babies are just the norm.
And I think a lot of that is because it comes back to mum's sedentary nature during the pregnancy. You know, if you're not moving, it just affects the way that as I say, the ligaments that hold the uterus in and the pelvis all together. A baby does tend to get stuck, as you quite rightly say, OP, and then it's much more difficult for them to turn. And one of the things we're taught from a paediatrics point of view, and I see, you know, a lot of, is when baby is in the birth canal and they're OP, their parietal horn, which is this bit here, gets stuck on the sacrum, so they can't then turn, and then they get fatigued, and mum gets fatigued, and as you know, it starts that cascade off then. But it then moves that rotational stress from the baby's neck through the cranium, and there's a bone in the cranium called the sphenoid, which articulates with pretty much every single bone in the cranium, including the jaw. And if you rotate through here, you're going to affect the jaw position, you're going to affect all of this down through here, you're going to affect the cranial nerves underneath as it exits through the brainstem, and all the swallowing mechanisms. So that in itself can have knock-on effects for mum and baby going forward. So it's, you know.
And things like feeding issues, I'm guessing, and things like that as well, because actually their jaw can't feed effectively then, I'm guessing.
They can't, yeah, it can be as purely as mechanical as they simply cannot open the jaw enough to get enough of the nipple in to feed properly, to more of a compression through any of the cranial nerves. One in particular is the hypoglossal nerve, which passes through one of the sutures, which is like a cartilaginous bit between the cranial bones. And if that gets compressed enough, it will completely affect the tongue movement and the tongue development. So you end up with a tongue that doesn't come straight out, it goes off to one side. It also can affect the vagus nerve and the sympathetic nerve supply in the neck, which is part of the neurological system that controls the fight-flight response. And these are the babies that won't settle, they don't sleep very well, they don't feed very well, they just are really unsettled, really unhappy babies. And you know, that when we get those in, what we focus on is the cranium and releasing all of this tension off through the neck and everything else to release the pressure on the vagus nerve, which just calms the sympathetic nervous system. It's the old, I refer to it as the oh shit response, because of the way my brain remembers these things. But you know, when you like Neanderthal seeing a tiger coming out of your cave and you get that oh shit response, and your heart increases and you get a dump of adrenaline and your pupils dilate because you're now worrying, you need to get as much light into your system as possible to see that tiger, and then you deviate all of your blood away from your organs off to your muscles because you're running away from the tiger. If you've got a baby that's constantly got this overstimulation, it doesn't settle, it doesn't feed, they're just really unhappy babies. But actually it's quite, I love treating them.
And I certainly see it with the babies who have, you know, I've referred to parents to encourage them to see, you know, chiropractors, osteopaths, someone who's trained in cranial sacral therapy specifically for babies. And actually you see a big difference in them later on down the line, those babies who maybe had von-2s or forceps or just really long labours where, like you said, either they don't feed and they are very reluctant to feed. You know, they're the ones that have been in hospital trying, and the mum's getting stressed and the baby's getting stressed, and it all just gets on that knock-on effect. And we're starting to see, there's a piece of research going on at the moment about cranial sacral therapy and tongue ties, which I'm interested to see what the outcomes are. But I've seen it as a health visitor, the difference interventions like that make. And it's amazing how you can track that back to labour. And then even then, before that, the whole of the pregnancy, really, and what position that baby got in, and potentially to do with, you know, any ailments, things like pelvic girdle pain in pregnancy, that potentially had that, you know, cascade going forward, really.
Yeah, absolutely. Yeah, we see it all the time. It's really, really prevalent.
It will be good to see lots more research in the future, and actually whether, you know, we'll know more as time goes on in terms of the impact SPB has or pelvic girdle pain has.
It's a really difficult subject to get really good solid research on because of the ethics. You can't knowingly leave a group of babies with feeding issues just to see what happens. So that's where we struggle as a profession, is to get that. It's called a double-blind random controlled trial. It's really difficult to get that through the ethics committees, but we are trying. And I know it's actually, I think it's in Trowbridge, isn't it? It's not far from here that they're doing. Yeah, it's Trowbridge way. Yeah. It's the osteopaths doing it, I have to say, hats off to them. It's not the chiropractors, but a lot of the techniques that they use are the same, if not similar. Actually, chiropractic and osteopathy was developed from two friends. I can never remember the name of the guy that developed osteopathy, but our guy was D.D. Palmer, and they were both in the States, and they kind of realized that if they applied a thrust to a joint, that it would release and cavitate, and that had effect on the neurological system. And that then they had an argument. I don't know what it was about. And D.D. Palmer stayed in the States and carried on developing chiropractic, and the osteopath guy went over to Europe and developed osteopathy. And so that's where the two professions, but a lot of the principles and a lot of the techniques are very, very similar, if not the same.
Absolutely. I'm really excited for the trial because one of the people that I knew from Cloth Nappy Network, she was telling me she was part of that trial. Actually, she had feeding issues, massive feeding issues at 6 weeks, and the GP offered her to be part of this trial. And she said, I went for the first 2 weeks, and she was obviously part of the trial where she'd obviously been randomised, and she knew she'd been randomised because there was no difference in her baby. She said, and I've had treatment myself in the past as a woman, so you know, it looked like they were doing stuff, but there was no outcome. And then they did treat them later on. So any baby that didn't go through treatment, they did then go on to treat, but they didn't tell you for 4 weeks. You kept going for weekly treatments. And then at the end of the 4 weeks, they then did the proper treatment if you were in the randomised part where you weren't given any treatment. She said it was like a light switched suddenly in her child. The feeding became better, the weight gain improved, and suddenly she had a settled baby who slept a lot better. She said it was, just to see it was amazing. And she was like, every week I went, it just didn't work. But yeah, fingers crossed that trial will show something which will be good. I've got a couple more questions that have come through. So my pelvis is separated again, so I get the pain at the front, even to the touch. I also have burning hip pain in both hips again. That's very typical of pelvic girdle pain, isn't it?
Yeah, it is. Yeah, it'd be interesting to know how far along that lady is. I can just about see the question on my screen. Advice there would be don't open your legs. Probably what got you in that position in the first place, but in all seriousness, don't. Like, getting in and out of the car, getting out of bed, getting off a chair, you've got to keep your knees together, take that pressure right off the pubic symphysis at the front. The hip pain, again, my question would be, is it actually hip pain here, or is she talking about pain at the back here? But either way, if that pelvis is if the pubic symphysis is separated, all of these muscles, the glute muscles at the back, will contract to try and save it, as it were, and that's what will be giving you the burning pain at the back, is just that constant over contraction. So to massage might help through the back there. You might want to try a belt, but I say that with a degree of caution, because it, as I say, can really irritate it if it's inflamed. The other thing that I found really helpful, and I honestly thought this was a complete load of rubbish when someone told me it, but it worked, was castor oil hot packs. I know that was my face too. I was like, get away, don't be ridiculous, but it worked. And I just put castor oil, buy it off Amazon, and a cloth, and soak the cloth in castor oil, put it over your pubic symphysis next to your skin, and then put out a warm hot water bottle, not hot but warm, just so the heat gets in there, and it worked wonders for me. It didn't fix it, but it was a lot better. But go figure.
Does that not have any implications for sort of inducing labour though? I know usually with castor oil you drink it and consume it to be able to, the old sort of school induction, but not a good idea for anybody, can I just say?
No.
Because it causes horrific diarrhoea and has some bad outcomes.
Yeah,
but
I guess because it's topical, it doesn't have as that same effect. It certainly didn't induce my labour, but that's just my personal experience. But that was one of my senior colleagues that, as I say, she suggested it, and I looked at her and went, don't be ridiculous. But worked for me. But yeah,
interesting.
There you go.
I'll have to have a bit more of a read on that now. Again, because we're just told from day naught as student midwives and as midwives, castor oil is just a no-go, just in general. So that is something I'm going to go away and read about.
I have to say, but I guess it's more of the ingestion side of it. But it's supposed to be really, it's got lots of anti-inflammatory properties. So that was the sort of conclusion I came to it from, and that's how, that's how it's worked in that respect. But yeah, just don't drink it.
Yeah, no, please don't.
Tea.
And then the other one was, I am 10 weeks pregnant and with my 4th pregnancy. I had SPD with my 3rd and was bedbound again. I'm now feeling the pain again. Currently have chiropractor every 2 weeks and I'm already very worried about the pain.
Yeah, I would be. Sorry. Persevere with the if it's that bad already, I'd say you need to be seeing them more regularly than 2 weeks. Yeah, just keep going. I mean, I would hope whoever it is you're seeing has got pregnancy training, because they shouldn't be manually adjusting your low back or your pelvis at this point. I'd suggest if it's already painful, it's probably fairly unstable and you don't want to be manually adjusting that. So yeah, just keep going. It's going to be a case of get through it, but use that 12 weeks after you've had a baby to try and reset it. You've got that golden opportunity, use it.
Perfect. And then there's one final one down here. So, can having a tilted pelvis affect the birth? My first was £10.13. Good size, well done you. And I couldn't actually go into labour after being induced twice. The second pregnancy, I'm having a lot of pain in my back left side already, the sacral iliac joint. I'm not sure if it's pelvic girdle pain, because I feel like constant pressure when walking.
I mean, you can call it pelvic girdle pain if you want. It, as I say, it's just a term that's catch-all. But yes, it sounds like you've got a left SI issue. Get it treated as quickly as you can would be my advice. But as I say, just make sure you find someone that's got the relevant postgrad training, because they shouldn't be jumping all over that. And the other one I'll just pick up on you. I know there was a question from someone about hypermobility syndromes.
Oh yeah, that's another one. Yes.
There is growing amounts of research to say that actually hypermobility syndromes, whether it's just the syndrome or the full-blown Ehlers-Danlos syndrome, is a contraindication for spinal manipulative therapy. They need to be treated differently. That's not to say you can't go to a chiropractor, but there's sacrooccipital technique chiropractors, there's activator chiropractors, McTimoney chiropractors. I'm trained in the first two. I'm not McTimoney trained, but it's just there's no force through the joints, and if you've got hypermobility anyway, you really shouldn't be being manually adjusted and pulled around left, right and centre. As regards pelvic girdle pain with hypermobility and EDS, you are more likely to have it. You're more likely to have incontinence issues and pelvic floor issues. There's lots of research out about that. Off the back of that question, I contacted a colleague of mine, and she's director of the academic affairs of the Royal College of Chiropractors, and she sent me some articles. So if anyone wants them, I'm quite happy to share them with you. But there's lots of research out there now to show that that is a thing. However, good news is you're much less likely to need a C-section. So yes, it is a precursor for PGP in a nutshell.
Amazing. And I mean, how do you tell? I mean, hypermobility is not an area I know anything about. How do people know they're hypermobile? Is it easy to see as a chiropractor?
Yes, there's certain tests you can run to see how hypermobile people are. Typically ones is, can they put their thumb to their forearm? I'm fairly hypermobile. Then you look at the elbow extension. Do they hyperextend their elbows? Do they hyperextend their knees? Are they flat-footed? So it's basically what level of ligamentous support isn't there anymore. There's more specific tests, but that's kind of outside my realm of expertise. If I had someone in that respect, I'd probably send them over to one of my colleagues. But yeah, I'm happy to send you the documents for that, because it's something that you can easily read, and just it's a quick scan with mums or patients to see, you know, what's going on if you think there's an element of hypermobility there.
Amazing. I think that's probably all of them. So Charlene O'Neill has just said, who would I need to go and see for the hypermobility? So we've covered that, hopefully. And then a lovely comment. So from Tony WE66, she treats me at a Kube. Sam, she's fantastic. So yes. A lovely little one.
Tony was my first home birth, actually. She was a long-standing patient. She came in many times in tears with horrendous SVD, and she said, would you come and assist at the birth? And I said, as long as the midwives are happy. So I did. It was an incredible experience, but yeah, and actually my chiropractor Steve came up from Southampton to help me with my birth at home.
Wow.
Because I was having trouble. So yeah.
Can you do chiropractic techniques in labour?
Yeah.
Wow.
If that sacrum's not nutating properly, the focus is to get that sacrum to move, because as you know, that sacrum needs to lift to allow baby to come out. So there's lots of techniques you can use in labour, and in fact there's some that I actually teach dads to do. I'm never quite sure how effective they are, but it gives some dad something, you know, tangible to do to help mum out. But yeah, just to lift that sacrum so baby can come out. And I speak from very first-hand experience, it really works.
Well, I have to say, things like spinning babies techniques were developed with chiropractors. It's something I signpost people to. It's, of course, I plan on doing at some point within my midwifery career whenever they come back over to the UK, because at the moment COVID can't get people from Australia to the UK, and they were supposed to be here last year, and well, you know, here we are now. But yeah, I think there are lots of things that we could probably implement that would probably decrease our cesarean rate, our prolonged labour rate. But it's interesting to know how much chiropractic techniques you could do potentially, I guess, to ease that baby through the pelvis, really. Yeah. Amazing.
Well, I've got another home birth coming up in April, so maybe I'll see you there.
Do you actually go on call for them?
It's not something I certainly don't advertise it. If I've got a mum that I've treated that would like me there, and again, if the midwives are happy, it's a real honour to be at a birth and help out, and I just go and do what I can. But you know, it's always with the proviso that I've got sort of my own children and family and clinic and everything else. So it's very much of it. If I can be there, I will be there, and I'll do as much as I can. But it's not something I don't. It's nothing more formal than that.
Yeah, that's amazing though. I think that's wonderful. It really is.
Yeah.
Well, thank you very much, Sam. I think that probably sums everything up, actually. I think it's probably been very helpful for people, and we've got some lovely thank yous coming up, actually, that's really helped some people. And I'll save this to IGTV so that it can be shared on my page, and you can share it as well through stories. And certainly any time that I get a question now with pelvic girdle pain, I'm just going to direct them to this video. And as I always do anyway, to, you know, osteopaths, chiropractors and physios for treatment, because you don't have to suffer with pelvic girdle pain. You can have the symptoms manageable and make it treatable in pregnancy, which will really help.
Yeah, absolutely. Couldn't agree more.
Thank you so much, Sam. It's been lovely to talk to you, and glad to see you the other side of labour and birth now.
Yes.
And
So am I.
antenatal period.
I'm doing it again. All right. Take care, Angie.
Take care.
Thanks.
Bye.